denture wearers getting younger every single year. Like 10 years ago, it was 40, and now it's like 28. And these people getting these dentures so young, I mean, there's going to be such a demand for implant-supported dentures, all on fours in the future. It's really the time to get into this.
Hello, everybody, and welcome to another episode of the Raving Patients podcast, sponsored by Acclaimed Dentistry. Today's guest is Lorin Berland, a no longer practicing dentist, but someone who's very well known in the industry. And we're going to be talking about nothing clinical, but we're going to be talking how to make your denture practice more profitable. You know, a lot of us do dentures. A lot of us hate doing dentures. I actually enjoy them in my practice. But a lot of doctors complain about doing dentures. Well, what we're going to be talking about today is going to make you think twice, because we're going to make your denture practice more profitable by some of the things that Lorin is been traveling the country. I see him at a ton of meetings. He's trying to get the word out about some of what his products can do to your practice. So please welcome to the Raving Patients podcast, Lorin Berland. Lorin, thank you so much for joining me today.
Thank you so much for having me, Len.
Well, I'm glad we were able to finally do this. I know we've had some scheduling snafus but we're both very busy, and that's understandable. So, for to begin the podcast, why don't we let the listeners and viewers, because we are recording and going to have a video podcast of this, why don't you let the listeners and the viewers know a little bit about you, your background, and most people know who you are. They've seen you speak on cosmetic dentistry over the years, but I know you told me a very compelling story when we sat down at the Yankee Dental to talk. So why don't you share some of your background and how you transitioned from practicing dentist to these products?
Well, it's been a long journey. This is now my 51st year in dentistry. I started when I was 15, working in a denture laboratory near my high school in Skokie, Illinois. I come from a family of denture wearers, so working in a dental lab, especially with dentures, seemed to be a noble thing for me to do, and it was a convenient job, and I like to work with my hands. And from there, I progressed to work in a private practice, Dr. Unterman in Chicago, and I became his personal denture assistant. I was there for the wax try-ins, and I learned a real lot from Dr. Unterman. He taught me, the key to success with a denture usually depends on the wax try-in. And no matter what you do, you always have to fiddle with that wax try-in. You've got to make things a little special. And don't worry about a second wax try-in, because it's better than redoing the denture. Anyway, he taught me so many tricks. And that's when I really fell in love with dentistry, working with him and seeing the incredible difference that, dentures can make for a person. I mean, for some reason, a lot of dentists, we kind of neglect our denture patients, or we look down on them. And it's really sad, because nobody needs us more than the people with, who are edentulous or partially edentulous or soon to be edentulous. The people with the terminal dentition, they're terrified to see a dentist. So, we really have to reach out to them. And according to the demographics now, this population is exploding. Everybody thought dentures were going to go away, but they're bigger than ever. Anyway, so after I worked in this lab, I got so excited, I went to dental school, and then I practiced in Dallas for 35 years. And 20 years ago, I saw so many changes and so many improvements in dental care and in dental treatment, but I didn't see anything improving for dental products, for dentures. I mean, think about it. Nothing has improved. They don't even have the ADA seal of acceptance, most of the denture products, whereas all of their toothpaste, their mouth rinse, even their toothbrushes have the ADA seal. And, starting out 20 years ago, I knew a lot of things. I knew that zinc in the denture adhesive was causing Alzheimer's, but I knew it was necessary because the copolymer required it to activate it. I knew that the soap cleansers were completely ineffective. All they do is kill 90% of odor-causing bacteria, but they do nothing for the dangerous pathogens that are infecting all the dentures and all oral care appliances, especially airway appliances, with candida, strep, staph, actinomyces, E. coli, causing thrush, pneumonia, digestive infections. So anyway, I started working on these products 20 years ago. And when I did, all my friends were saying, what are you working on denture products? And they're going to go out. But no, denture patients are growing. It's not just because people are getting older, which is one reason why denture patients are growing, but also the average age of a first-time denture wearer is getting younger every single year. Like 10 years ago, it was 40, and now it's like 28. And these people getting these dentures so young, I mean, there's going to be such a demand for implant-supported dentures, all on fours in the future. It's really the time to get into this.
You had to exit dentistry. So why don't you talk about that, where you couldn't, I mean, look, I'm 50 years old. I'm 48 years old, sorry, but I'm going to be retiring at 50, but that's by choice. You unfortunately did not have a choice to exit dentistry. You had an accident. So why don't you kind of let the listeners and viewers know a little bit about that? Because that really transitioned you from clinical dentistry to doing something differently.
Absolutely. I started developing these products 20 years ago, and I was testing them out with my patients. We had questionnaires, evaluations. I would share it with my friends who are dentists. And, we just, every product went through several generations until everything was okay. And we pretty much, we did have everything finalized in 2015. I had all the FDA approval, and knowing that none of the big pharma companies, Polydent, they didn't have the ADA seal of acceptance. And I was a dentist for 40 years. I said, well, I'm going to get the ADA seal of acceptance for all my products, which was way harder than the FDA. And so in 2015, I got all of this. I was ready to go to market, except I didn't have any packaging or anything. But anyway, I did nothing with these products for another year and a half because I was a practicing dentist. And as everybody here who's listening or watching knows, the life of a dentist is ridiculously demanding. You have so many hats to wear. And it was on the back of my mind, sometimes front of my mind. I was always, when am I going to work on these products? And I go, well, next year. I mean, tomorrow I've got a full day, about this full mouth rehab or this difficult patient. I just kept putting it off. And then 2016, July 12th, as a matter of fact, I was going for my morning bike ride before I go to work. And I was thinking again, one of these days I'm going to have to focus on these products. And the next thing I knew, I went flying over the handlebars, broke a lot of bones, and my dental career was over. Just like that. I was almost 60 years old. And I was 60. It was a big shock. And I had to go through a lot of surgeries, and there were some complications I don't really need to go into. But, I immediately had to sell my practice. And about a year and a half later, it was time to launch our products. And my son, JP, my oldest son, who's kind of been working with me from the beginning, he quit his job. He was working on Wall Street. And we launched our first product in January of 2018. So it's been 4 years, and we launched our sixth product last fall, a year ago.
So I have a question for you. If you didn't get injured, how long do you think you would have been practicing dentistry for? Because said you were 60 years old when the injury took place. So how long did you plan on practicing dentistry at that point for?
I never really thought about it. And you're bringing up a great point, because you said you plan on retiring at 50. I was just blowing and going. I had a multi-specialty practice in Dallas. We had a periodontist, a prosthodontist, an endodontist, a general dentist, and me. I mean, it was a very, very busy practice, and I loved it. And while I had other interests, I was a total dental rat. I just loved dentistry. You got gym rats. I was a dental rat. And, I don't know when I would have. So, when it happened, it seemed like the worst thing to ever happen to me, the accident. But it could be the best thing that ever happened.
Well, because it opened this other part of your life.
Yeah,
That
yes, a whole other. You know, my life has been completely different the last 5 years than it was the previous 30 years.
Yeah, and I want to make a point to that, Lorin. I want to be so everybody knows that I had a software program I developed. I sold to Bird Eye, which has allowed me to do many other things in my career that I never thought I would be doing prior to that. And when I talk to dentists, dentists always wish they have an outlet so they don't have to be trapped in the op, and they feel like they're trapped in the op, too much. And running a business, as you mentioned, is very difficult. So why I wanted to bring this up is that you had no exit plan at 60 years old yet. Okay. The injury forced you to retire from clinical dentistry and you had something else to fall back on. So I just want to make it very clear to people that you have to have something to fall back on in case you want to retire because there's many dentists who work till they're 80 and don't stop working until they're dead. And there's plenty of people who work until they're in their 60s and don't have another thing to fall back on. So I just want to make that a point is that you actually had something to fall back on. So it allowed you to continue working with dentists, but in a different capacity.
It's very, very important for every dentist from the time, if they own their own practice, or even if they don't, but especially if they own their own practice, they have to make a plan in case something happens to sell that practice. I learned this the hard way, way too late. I think that everybody every year should have an evaluation of their practice. It may cost a couple grand the first time, but then just revamp it on an annual basis. So God forbid, if you have to sell your practice, you're ready. I was very lucky. When I had the accident, I broke a lot of bones. My body was a mess, but my brain was still kind of working, sort of working. And so I was at least able to handle all that. And it was difficult but I could handle it. So you don't have a choice. So every dentist, you work really hard your whole life. Make a plan. You don't have to jump on it. Things happen. Shit happens in this world. And a dental practice is a humongous, it's a great thing to have. But if you have to sell it, you have to sell it. And you should be ready. You don't want to be caught short-handed when the time comes.
And I agree with that, 100% so. Let's fast forward a little bit because I want to start talking about a little bit of the content rather than the background behind it. So I think you may have mentioned a couple of things, but I'm sure there's more to it. Let's start talking about the misconceptions surrounding denture wearers. I know you said the average age is dropping significantly, and there's going to be a lot more denture wearers out there. But what other misconceptions are there about denture wearers out there?
There's several. One, that they're all old.
And they're not.
And they're not. Two, that they really don't care about their teeth. And that is true to a point, but that changes by the time they come to see you. They're obsessed with their teeth and they're obsessed with their appearance. There's a lot of reasons why the number of denture wearers, first-time denture wearers, is growing. As I said, there's the aging of America, of course. There's also drugs, both prescribed and illicit. There's a pandemic of that. There's bad diet. There's bad education growing up. And social media. I think that is what's really driving a lot of young people to dentures. And all people to dentures, because, dentures were the original cosmetic dentistry. And I see it now. I'll bet you don't know this, but there are all these denture Facebook groups of people with dentures. So I'm on them. I talk with these people and I see their concerns. And these Facebook groups are exploding. I've seen some that started a year ago that now have 9,000 followers and posts like crazy. I mean, I don't know how many denture Facebook groups there are, but most of them have over 10,000 followers and 50 to 100 posts every day and so many comments. And these people, it's really true. They don't know where to go. They're basically, whether they're affluent. I saw it in my practice. Let's talk about this one. In my practice, I had a very high-end practice. And I always liked doing dentures. And yes, most of my patients were higher socioeconomic. and I didn't see a lot of denture patients, but I loved them. I did denture patients for the people who worked in the building. If I knew they had dentures, people who worked for me on a personal basis, I'd do dentures for them because I just loved it. In fact, I wrote a book and a cosmetic imaging system 20 years ago called the Smile Style Guide and basically I did it with veneers because veneers were hot at the time, but I planned it all with dentures. Everything I learned about cosmetic dentistry, I learned in dentures. So this is before your time, Len. You can't remember, but 30 years ago, nobody bleached their teeth. It just started in the early 90s and it was explosive. I mean, everybody, the whitest teeth alive were A2 in those days. And now, no, that's like a dingy gray. So anyway, I'm practicing in Dallas and I'm a young dentist, but I had a great reputation, or I had a reputation as a cosmetic dentist because at the time I was the first fellow in the AACD, and I started seeing, there was no internet then, but when bleaching came out, I had a patient come in and I was a young dentist and she was a big society lady. She was always getting best dressed awards at there would be a Neiman Marcus luncheon for best dressed women of Dallas. And she made an appointment. I see her on the schedule because I see her all the time in the papers. Remember newspapers? That's another thing in the past. And, anyway, I go, wow, that's so cool. I'm seeing, a celebrity in Dallas. And she comes in and she wanted me to bleach her teeth. The only thing is she had dentures. And, and they were all ground down and worn down. And I said, I really can't. I mean, I could whiten them a little bit, but they're worn down. Don't you want a better looking smile? We could go to B1. That was the whitest you could do. And nobody wanted B1, but it started happening. Now, that's old too. And I was really surprised that she had dentures because money was no issue, obviously. And I said, tell me, how long have you had these dentures? She grew up in West Texas and they had a lot of fluorosis there. And it was the total opposite. If you were well-to-do, you would get dentures for cosmetic reasons, especially a young woman for graduation, wedding, whatever. So she got her dentures. She went to SMU, which was a private school in Dallas college. And she met her husband, stayed in Dallas, and never went to a dentist in 20 years until bleaching came along and she just wanted whiter teeth. So we made her denture. And then I started seeing her sorority sisters from West Texas who also went to SMU, who also had dentures. And then I started having a reputation for doing cosmetic dentures. And I had a periodontist in the office and we would talk to them about implants. And this is what's surprising. I mean, yeah, sure, it was early 90s and implants were still kind of new, but we did them. And I don't think out of all those dentures of these society rich ladies and men, there were men too, maybe 20% of them opted for implants. All they wanted were better looking dentures. I mean, people do not understand how important cosmetics are to a denture. That's why I started telling you about Dr. Unterman and the good looking denture always tends to fit better. So, I mean, that's one big misconception, that denture patients are poor. Affordable Dentures has capitalized on it, but they're seeing, because they're so big and they're so broad, people are going there who don't need affordable dentures. They need premier dentures, and they're raising their game drastically too. And that's just what I wanted to say, is that that's one of the big misconceptions of dentures.
They don't have money.
Is they don't have money, because they do. People spend money on everything right now.
So, we have limited time, so I don't want to belabor the point. Why don't we talk a little bit about your product that you have, and it's called Dr. B's Dental Solutions. Why don't you talk about your products, what the goal of the product is? Why don't you run through a little bit about what you offer?
Oh, sure. I'll just go through it real quickly. I don't want this to be a sales pitch, but I think everybody on this podcast should know about them. The first product I started working on is Adhesident, and that's a zinc-free, all-natural denture adhesive that's got aloe vera, vitamins A, D, and E, and a new copolymer that does not require zinc. I started working on this 20 years ago because I knew the zinc was causing Alzheimer's, neuropathy, all kinds of problems. So about 10 years ago, I don't know if people realize this, the FDA made all of the denture adhesives either remove the zinc or reduce the zinc and put a warning label on it. And it's trace amount of zinc. A little bit of zinc is good for people, but when they start putting it into their oral mucosa and wearing it all day, a little bit of zinc is really absorbed and causes problems. So 10 years ago, the FDA did this. Too bad my product wasn't ready 10 years ago. But, when people say, oh, denture adhesives don't work like they used to, and dentists say, well, it's because you've had a lot of resorption and you need implants. Well, that's true. Both people are true. Yes, they do have resorption. They need a reline or a new denture or implants, but denture adhesives don't work like they used to. So then the next thing, when we were working on the adhesives, people told me, God, how do I get this gunk out of my mouth? They're talking about, their adhesive, debris, biofilm. They never use the term biofilm, but it's pretty disgusting. So I came up with Clean-A-Dent paste. And they told me, can you do something that moisturizes too? So we put in all these moisturizing agents, and it's half as abrasive as baby toothpaste. It's the only toothpaste that the ADA accepts for prosthetics and implants, as well as oral tissue. And that has aloe vera, vitamins A, D, and E, coconut oil, and tea tree oil. Then we came up with the best ergonomic, extra soft toothbrush to use the Clean-A-Dent paste in the mouth and on the denture. Because those denture brushes that you get, nobody can use them. They're only good for cleaning the grout off the bathroom tile. Can't use them in their mouth, can't use them on a denture. Then we came up with a paste in a white version for on the go. People love it. They can go to the restroom, clean their denture, throw it out. People are also using it to clean the edges of fixed hybrids. The all on four when things go out. And off the shelf, people are using it to clean their dog's teeth. I didn't know this. People told us. Now I use it to clean my dog's teeth. It works. No more doggy breath. Then I think really our most important product is the liquid crystal. And because that's universal, every air appliance, because, people with airway issues, they tend to have the same comorbidity problems that denture patients have. They're prone towards thrush and pneumonia. And actually, studies prove that a denture wearer is twice as likely to have thrush and pneumonia as a non-denture wearer. And if they sleep in their denture, they're 4 times as likely. And why? It's not the denture, it's the bugs that are on the denture, because studies show that within 6 months, almost every denture is infected with thrush, with candida. So I came up with a liquid crystal, a soap cleanser that kills candida, pneumonia, all the dangerous bugs. And then I wanted to go another step further because O-rings, you can't use any of the conventional soap cleansers on an O-ring. It causes them to deteriorate faster. And what needs to be cleaned more than an O-ring on an overdenture? So we tested our soap cleanser with O-rings, with Zest, the world's largest manufacturer of implant accessories for overdentures. And it's the only soap cleanser that's safe for O-rings. So that's my pitch in a few minutes for all of our six products.
Just to clarify.
Oh, one other thing. Yeah. We have the coolest ultrasonic cleaner, proprietary sonic cleaner. It has 5, 10, and 15-minute timer. It's deep, but it doesn't have a bigger footprint. So you can put 2 arches in there, whether it's an upper and lower denture or an upper and lower airway appliance, or retainers and aligners.
Okay, so just to clarify for those, you have Adhesident, which is denture adhesive. It's a moisturizing denture adhesive. You have Cleanadent paste, which is a dental prosthetic and mouth cleaning paste. You have Cleanadent denture and gum wipes, which is a moisturizing cleansing wipe. You have the liquid crystals, which is the disinfecting dental appliance cleaner. You have the ultrasonic cleaner. You said that it holds up to a number of different appliances, and then you have the toothbrush, the dental prosthetic and mouth toothbrush. Those are your 6 products, correct?
Exactly. You did it better than me.
Okay, well,
Thank you.
I was looking at the website, but I took some notes before our call just to make sure I knew what we were talking about. So talk to me how people get the products. I know that they're available. The goal is obviously for the dentist to either sell directly to the patients or resell the product, or patients can buy directly from you. And I know they're available on Amazon. I know Dental Stores has them. What's the distribution that you have?
They're available on Amazon. They're available through Dental Store, and they're available on our website. Amazon doesn't have all the products yet, but all the products are available on our website. And I practiced for 35 years, and I had a very successful practice. And I always gave away stuff. I charged enough that I could give away stuff. But if I thought that there was a home care product that would help them, I would usually give it to them. And then they would come in for refills or would give it to them for free. The internet wasn't quite what it is now. But people love you when you give them stuff for free, because that says you really care. You're not just charging them, especially when you're doing, life-changing dentistry, which pretty much all dentistry is life-changing. We tend to take it for granted, but everything we do has consequences, not just technically or physically, but even what we say. So when I first launched our products, the liquid crystal, I was talking to dentists that I knew, especially dental sleep medicine. I have a good friend, Kent Smith in Dallas, who's like,
Sleep guy.
Yeah, he's the guru of dental sleep medicine, and he's just a great, great guy. And I was telling him about a liquid crystal, and I sent him some, and also the sauna cleaners, and I didn't hear from him. And he calls me up like 2 months later. He says, "Hey, that stuff really works." I said, "Yeah, I know, but what made you say that? What, all of a sudden you call me up?" He says, "Well, I had this sommelier in my practice that was referred by his physician, and everything was going well with his breathing and his airway, but he said he had to stop wearing it and he wanted his money back because he couldn't do his job. He couldn't really smell or taste anymore." And Kent looked at him, and he looked in his mouth, and it didn't look anything out of the ordinary from what he was seeing. But what he was describing was a mild case of thrush, though he didn't see anything. So he handed him the liquid crystal, and he handed him the sauna cleaner. And he said, "Try this and come back in 2 weeks." And the guy came back in 2 weeks. He says, "Everything is solved. Everything is cured." So now Kent gives the sauna cleaner and the liquid crystal with every airway appliance. But what I was saying is, when I started telling people about the products, and I would say about the sauna cleaner, they didn't know what I was talking about. And in my practice, I always gave a sauna cleaner with any removable appliance. I would give Effordent, Polydent, but I always gave them stuff. I gave them tooth and gum tonic, Perioscience, and get them started. But now what we have a great system that, let's say you give them the product. You really don't want them coming back and buying it from you. I mean, some people do. That's fine. If that's what you want to do. You always want to have some in stock for recall and stuff like that. But we started an affiliate program where you can we put a customized landing page on your website. So when you dispense this product with the appropriate treatment, and you say, when you like this stuff, it's only available in doctor's offices, or you could buy it on my website, and you just you write in the office, to your monitor, point to your website, show them the spot, and you say you just order that here, and you get all kinds of specials, and it's cheaper. And usually, yes, it is cheaper. And then you get a commission check every quarter of 18% of the sales. And, you're not going to get rich of that.
So, but you don't have to stock the product, though.
You don't have to stock the product. And even better is people keep going to your website. And people talk. And they say, hey, you know what? I love this stuff. Where'd you get it? Oh, I got it at Dr. Tao's. And, that just go to his website.
Well, that's really great information. Look, I usually like, we're limited on time. I don't want to take up any more time with or go to the section on the Q&A because I wanted to get some more information on here. So if people are interested in learning more about the different products that you have, what's the best way for them to find out more information on it? And then also, was there an offer you wanted to offer to the listening and viewing audience?
Sure. The best thing would be, well, you could always contact me directly. The best thing is by email, drb@DRB Dental Solutions. And we could always set up a phone call after that. Then you could always go to the website, drbdentalsolutions.com. We have lots and lots of information there. And of course, all of the listeners and viewers, we want to offer you a 15% professional discount on your first order. All you have to do is the code will be Raving, like raving patients.
So guys, if you want more information about Lorin's product, please reach out to him. He gave you his email, the website as well as drbdentalsolutions.com. Make sure you use the word Raving to get 15% off the first order. And what do the products range in price from so someone knows what's the prices of the cost of the products that you normally have?
Gosh, well, we have the liquid crystal comes in a travel or trial size. It's TSA. That's like much cheaper. It's good for 10 to 15 cleanings. Then the economy liquid crystal is about $19. Pretty much everything ranges in price from like $10 to the most expensive is the sonic cleaner, which I think is $31. But, for dentists, that's if you buy one. We have a special professional portal where when you buy cases, because no dentist wants to buy one or two things. And we basically, when you buy it by the case, there's no better marketing for us than when a dentist gives it to the patient. So, we don't make a lot of money on those cases. You'll see they're way, way cheaper. But those are the suggested retail prices, $10 to $30 for every item.
Gotcha. Well, Lorin, thank you for joining me today. Thank you for sharing your insight. Thank you for sharing your story. And thank you for informing the listeners and viewers about your products out there. Guys, if you're interested, please reach out to Lorin. If you like the episode, please share it. Please let your colleagues know. As you know, we come out Fridays now at 5 a.m. in the morning, Eastern Standard Time. It will be uploaded to all the podcast networks. Check out the YouTube channel as well. If you have any questions for me, you can get a hold of me at len@drlentao.com and check out the website, ravingpatientspodcast.com as well. Until the next episode, remember, your reputation matters. Lorin, thanks again for joining me today, and we'll see everyone soon.